With us now is Janine Stiene, and she and I just received this wonderful honor on the East End for being Power Women. She is definitely a powerhouse. So excited that she's here with us. Welcome. Hello, hello, hello.
Thank you so much. It was nice to see you the other night, but also nice to see you again today.
That room was filled with like all of these really impressive people.
It really was. I feel like one person was just more impressive than the next. Every time someone came up and spoke, I was truly impressed with how much they've all accomplished, especially as women on the East End.
And I was impressed by the cheese platter. I could just live, seriously, like, I don't know if your favorite food group is cheese.
Yes.
Oh my goodness. I was like, oh, cheese and grapes and berries. I'm like, all right, I'm in heaven. But today we're going to be talking about Long Island speech. So what made you decide to go into this field of speech?
I think just always wanting to work with individuals of different ages to be able to make a difference. So working with rehabilitation, especially when you see their progress that they're making and how successful they've become, it's just so rewarding. So you want to continue to feel that all the time.
Why do you feel diction is important? That someone's able to hear and speak and communicate effectively and clearly?
I think so much of it has to do with social emotional health and social emotional well-being, but also just from a pragmatic standpoint, being able to communicate with your peers, being able to advocate for yourself. And in order to do that, you really need to have great diction and impressive intelligibility.
Word choice. Do you ever find a client that has modified what their word choices are because they know they can say some words, clearly, other words, maybe not so much?
All the time. And I find myself doing that too. And my memory seems to be going. I find looking for that other word to use.
Me too.
Yeah.
And as a talk show host, I have to tell you, sometimes I'm like, it's challenging for me. I'm like, where's the word? I see the word somewhere. I'm like, well, I'll just say this, right?
Absolutely. And that's exactly it. I mean, it's a nice compensatory strategy for patients and individuals to use, but sometimes it's important for them to be able to articulate exactly what they want to say in that moment.
Cleft palates, different types of ways that someone's mouth is structured.
Mm-hmm.
What are some of the types of patients that come to you?
We see the full gamut. So we see from infants to individuals that have a short lingual frenum, that little piece of skin under your tongue that affects their eating and eventually their speaking if it's not addressed, all the way up through an elderly individual who's gone through a TBI or had a stroke. So we're definitely seeing that full gamut and working on a bunch of different things.
Also patients that have thyroid cancer or that have had radiation, that have lost their teeth, because now speech is also different from them and you're able to help them as well.
Absolutely. Our goal is just to get them back to where they were originally or before that issue began. But it takes time and it takes commitment no matter what age you are.
Speaking of commitment, you invented something. Was that because you saw a recurring situation or challenge in your patients, or what was the preface?
Absolutely. So a lot of it started with the pandemic, being unable to see patients in person, trying to figure out a way that we can be just as effective from a distance or just as effective through a screen. So we created, or I should say I created, an appliance that will work towards helping our patients keep their tongue in the right position, which helps to open up their airway. That tongue in that proper position will also help with temporomandibular joint issues. And it also is going to be a huge benefit when it comes to patients with regards to articulation and placement, as well as with swallowing.
What about snoring? Does it help snoring, Janine?
We hope so. My fingers are crossed. A lot of times it's just that collapsing of the airway that causes us to snore.
Right.
So we're hoping if we can train the patient to keep their tongue in with this appliance, that we'll be able to open their airway and help them sleep better.
Okay, I think I might be a candidate for that.
Come on down.
Oh
Come
my
on
gosh,
down.
The last few years, my kids are like, Mom, it's really bad now. It's really bad.
It's all stress related. That's what it is.
That's what I say. That, or if I don't really drink, but if I had wine, for whatever reason, knocks me out.
Knocks you right. I get that.
We're making light of this, but it's supposed to be fun. It's supposed to be, appliance that's going to be helping people. So you have a cute name for it as well. What is it called?
It is called the Spot Pal.
Yay!
So yes, where your tongue, the major place in your mouth where your tongue goes for swallowing and speaking is called your spot, or the incisor papilla. So this is the pal. It helps you get your tongue to that spot.
Now, how soon will you be able to know if this can be marketed and developed and distributed?
So we are currently doing case studies with some of our patients, and it's been received very well. And now we're just waiting for the finalization with the patent so that we can move forward. We're hoping October that we can start marketing, and then come January, there'll be a big push to get it all over the place.
Congratulations.
Thank you.
And you got a top honor recently of some sort, besides the top 50 women. And it had to do, I think, was it the tri-state area or all over the globe? I don't know, Janine, just share with us, what's been happening in your world.
Yes, I know everybody's noticing me this year. I don't know how that happened, but no, excellence in healthcare, especially I think with the pandemic, being able to make those changes quickly and be able to support our patients in no time whatsoever, especially when everything's shut down. Being recognized for that is wonderful. It's nice for our patients to see that others appreciate that as well. So it's important to me that they know that we keep trying to get things better, and we're making a difference.
What's the first step so that somebody could onboard with one of your facilities?
First step is just to give a call to the office.
Okay.
We have our own billing department, our own insurance department, so the parents can call, the patient can call, they'll get a series of questions, and then we'll take it from there.
Congratulations.
Thank you.
It was a lot of fun having you here. And are there like certain vocal like patterns or things like A-E-I-O-U? Like what are some of the things that you would teach?
So a lot of what we're teaching is always having to do with breath support and using so much of your abdominal muscles.
Really? Okay,
yep,
here, I'm going to try.
Yep.
Okay, let's walk through a little exercise before we
Yep,
sign
so
off.
if you're
Okay.
sitting up tall,
Yes.
you want to make sure you're always using your diaphragm. So if you want the most amount of breath support, the loudest amount, you're always going to use those muscles here. So we always teach them to work with those muscles, taking a deep breath in and deep breath out, making sure that you can feel that diaphragm expand and contract. And then from there, we can shape anything that's coming out of the mouth with regards to articulation.
Excellent. Do you sing?
I don't.
You don't sing?
No.
Because all that practice of your diaphragm, because that's the same advice they give to singers, you could probably belt out a song.
I am definitely loud, but I don't sing.
I'm going to teach you how to sing.
Okay.
Okay, stay tuned. We've been living it up right here with Janine Stiene. And I'm actually going to go teach her a song. Thanks for watching.